Hello, and thank you for joining us tonight for our free webinar, Cosmetic Facial Aging, What's Really Going On, featuring Shellie Goldstein. My name is Jeff Bloom, Education Marketing Manager at LASA OMS. For over 40 years, LASA has been striving to promote the growth of the acupuncture industry by providing quality products, great prices, and the best customer service, as well as supporting the many schools and continuing education efforts available. With our free webinar series, we intend to provide free educational opportunities taught by some of our industry's most renowned practitioners and educators. I will take a moment to acclimate you to the webinar room. To the right of the video screen, you will see three tabs: Chat, Questions, and Polls. To chat with other attendees or to communicate any technical difficulties, please use the Chat tab. For questions of our guest speaker, please use the Questions tab and we will answer them at the end of the lecture. Please note that each webinar is recorded, and immediately following the conclusion, you will all receive an email with a link to view the video on demand and a copy of the slides. You may always visit our blog and use the free webinar tag to find all of our previously recorded events. From neuroscience to sports acupuncture to cosmetic acupuncture, you'll find something interesting for every practitioner on the LASA OMS blog. Now for our featured speaker. Dr. Shellie Goldstein is widely considered one of the worldwide experts on cosmetic facial acupuncture. She is the author of Your Best Face Now, Look Younger in 20 Days with the Do-It-Yourself Acupressure Facelift, and she's the creator of Touch and Glow, the Do-It-Yourself Acupressure Facelift Kit. As a leading authority and educator of cosmetic facial acupuncture, Dr. Goldstein founded the Academy of Advanced Cosmetic Acupuncture, which has recently partnered with the Pacific College of Health and Science to present the Facial Applications for Cosmetic Enhancement Training Program, which is called the FACE program. And Dr. Goldstein has also been featured on major television and cable networks and in the press, and she's also a columnist for Acupuncture Today. Please join me in welcoming Shellie Goldstein.
Hi, how are you? Thank you so much for coming, and Jeffrey, thank you so much for having me. LASA is just so supportive of everything that we do, and we really, really appreciate you. So here we go. This is an important topic. It's called What's Really Going On? And as facial acupuncturists, and as acupuncturists performing cosmetic facial acupuncture, our profession is not new at all, even though we think it's a modern treatment, but it's really named after my rung, and my rung means beautiful appearance, and it's very old. It was used throughout ancient China for the empresses and the emperors to keep their concubines looking beautiful and healthy. It was a combination of acupuncture and topical or digestible herbs. It was practiced for centuries throughout most of Asia as part of a holistic regime to enhance beauty, delay the visible signs of aging, and promote systemic health and well-being. So there's a balance between the physical and the emotional, the well-being as well. Today, it's one of the most popular specialties among acupuncturists in the United States. And what's interesting about it is it just keeps growing and growing and growing. Our profession as a whole is growing, which is wonderful. I was putting a program together and read that our profession has grown 34% in the past couple of years and is projected to continue to grow, both in terms of acupuncturists and people seeking acupuncture. So hooray for us, we're in the right place at the right time. But in 2014, I was part of the NCCAOM. We performed an acupuncture facial rejuvenation needs assessment survey. We're trying to look at the profession as a whole and in terms of specialties, and we were looking at where we stood as facial acupuncturists and kind of what do we need to do in order to grow as a business, and what do people think about us. And based on the response from all the people that participated in this needs assessment survey, it came out that of the acupuncturists that responded, 62% of their patients inquired about acupuncture for appearance enhancement. That's a lot. That's more than half of someone's practice. And then we asked the question, And I ask myself this question all the time is, why do people come to me? Why do people come for cosmetic facial acupuncture? And the answers I get on a regular basis is A, for prevention, B, as a desire for alternative and more natural system that is more congruent with our belief systems. But also there's this underlying concept of a conflict about aging. And this is what we're going to talk about today, is what is this conflict? How do we get that information from our patients? And then how do we help them resolve that? Because we know that acupuncture is not just treating the physical body, but it's treating the emotions and it's treating the psychodynamic component of it. Several years later, I put together this natural acupressure facelift system. It was the wand, which you can see, and inside was a point prescription for improving facial appearance. But prior to bringing it to market, I wanted to make sure that it actually worked. So I conducted a pilot study. There were 12 people in the pilot study. I gave them each a kit, told them how to use it, helped them go through the point prescription to make sure that they were using the points properly. And then I gave them a diary that they needed to keep every day and kind of mark what their improvements were. And some of these improvements were looking at face wrinkle reduction, face tone, eyes and brows, cheeks, jawline, neck, skin quality, and self-image. And what they reported was, whoops, let me go back, was that after 3 days of daily use, they reported statistically significant improvement in all of these. Well, the self-image to me was probably the most important one, and underlyingly the most heartwarming, and satisfying. Because if we can help someone feel better about themselves, we can help them with anything. And again, this I think is one of the beauties of our profession, is that we can do that too. Because you can go to an esthetician, you can go to somebody, a doctor, they'll give you a skin cream, they'll tell you to, get this enhancement procedure. But how does that change your self-image? Sometimes it makes you feel better, but I just think that what you do is so much more rewarding and impactful on that level. And I do believe I have this motto: when you feel good, you look good, and looking good helps you to feel better about yourself and others. And also importantly, not only does it help you feel good about yourself, but it gives you a more positive outlook about the world and about other people. So you may not be as judgmental, you may be more tolerant, you may feel, just when you feel better about yourself, you accept people more. And I find that to be so true. And I'm wondering if you do too. So in that, what I want to look at, and what I have looked at a lot in my own practice, is how I approach people, how I speak to them, and how I pay attention to them. Because I don't know about you, but what I hate most about going to every year I go to the doctor, I get a physical, not because anything is wrong with me, but I just want them to remember who I am in case I ever end up in the hospital. So I go there, and this is what I find happens. They sit there behind the desk, or they have a tablet, and they say, "How are you?" And they kind of look through your history, and they look at things that happened 10 years ago, and they say, "Do you still have this?" Like, no, I'm okay. And then they'll evaluate me. They'll go tap, 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 tap on the back, tap on the front. And then they'll, come up with something, if there is something or not, and they'll make some recommendations. And I just am concerned that as acupuncturists, we may be falling into that same patterning, when in fact, what makes us unique is that we don't do that. So when when we're looking at our patients, and particularly if you're just starting out in practice, what do? You ask questions, you do a review of symptoms, you do an evaluation, you might do a treatment diagnosis, come up with a treatment plan, and then treat, which is fine. I mean, that's part of what we do. But underneath, what we really need to do is look at it from the patient's perspective. This intake process that we do, How is the patient perceiving it? How are they relating to it? Are we establishing trust? Because establishing trust is so important. Because for us as cosmetic facial acupuncturists, what we really need to know is, how do you feel about aging? And how you feel about aging is going to also, as much as your underlying pattern disharmony, as much as what they tell you, I don't like this wrinkle, I feel bad about my face starting to sag, I'm looking like my mother or my grandmother or whatever, as important to that is, well, what is your relationship to that? How do you feel about aging? Are you coming into the office because you want to look better, because you want to look better, because someone has criticized you, because someone says, oh, you're getting wrinkles, you should do something about it? What's the pressure on you as a person in this? And it just is this catapulting conversation that goes on in someone's head about, how do you feel about aging? How do you feel about growing older? How do you feel about looking older? And the only way that you will actually, well, there are many ways, but the easiest way to help to understand that is to establish trust. And trust is not that easy to establish. If people come in, they fill out an intake form, they tell you what you think they want you to hear, and sometimes it's true and sometimes it's not. So really getting underneath to what's really going on is so important. And it changes with age. So for example, someone who comes in their 20s and their 30s, what are their priorities? Their social life, their chat on their Instagram or whatever they're doing, their social media performance. Do they have 1 million followers? Are they starting a career? Are they partnered? Do they have someone that they date or live with or not? What is their lifestyle like? Do they party a lot, or are they conservative, or what is that? Are they living at home? Are they living in their own apartment? Are they living with other people? And generally in their 20s and 30s, there are really not many physical changes, and they're still feeling pretty physically fit. So when you ask them about their relationship to their self, or a relationship about aging, it's not, they don't get it. They don't really relate to it because they're not there yet. They haven't started to see changes. They haven't started to experience changes. So it's a head game. Oh, fine, I'm not going to worry about it. It's going to be fine. And then as you age a little bit more, and your patients who come in are in their 40s, 50s, something like that, in that range, they may be more interested in career or more involved in their career. They may be partnered or even have a family. They have their peers, and they're starting to see some signs of visible signs or possibly visible changes or physical changes. How do they feel about that compared in relation to themselves? How do they feel about it in relationship to their peers? Are they comparing themselves to their peers? Is there pressure on their job to actually look younger or be younger? We don't know. And then there are people in their 60s and up, and then you start to see some physical changes, you start to see some visible changes, you start having more feelings about aging and examining your life, reevaluating your life, and can you accept who you are, and can you accept your life choices, and can you accept where you're going and how you're looking. And somewhere in between the 40s and 50s and the 60s, this thing happens. And I don't know how many of you and how old you are, but I know for me, it started probably about this time in my mid to late 50s, early 60s, where I started looking in the mirror and I'm thinking, whoa, I used to have really high cheekbones and I used to have a nice sculpted jaw, and it's starting to reverse. My jaw is starting to get wider than my cheekbones, and it's kind of shocking. And I have to ask myself this question: well, what's going on? Am I okay? Who am I? And it's particularly uncomfortable for people who actually rely on their outward appearance to validate who they are inside. Because if all you think you are and who you think you are is validated by your appearance, when that changes, you can set up a crisis. I mean, for those of you who are watching the Olympics, let's look at, what's happening in the gymnastics with Simone Biles. She's having a really hard time. God bless her. She's 24. She's supposed to be the best gymnast in the world, and the pressure is horrible. And for her to be able to trust herself and to be able to say, okay, I am who I am. Will you still love me? Or how will you see me, or what will you think about me if I'm not who I am as a gymnast? Well, it's the same for us as we age. Will you still love me? What do you think about me? Who am I in this world without, high cheekbones, sculpted jawline, a beautiful appearance, as I start to change? And it's a bit of a dilemma. And for some people, it can be just a simple transition, or it can be a crisis. And it's a real phenomenon. It's a period of transition and questioning of one's identity and one's self-confidence. And it usually occurs between the ages of 45 and 65 years old. It lasts about a year or two. And it's actually described as a psychological unraveling brought by the events that highlight a person's growing age, inevitable mortality, and perceived life's accomplishments, which is true, because at some point you hit the 50 mark and you think, oh, I may have lived longer than I will live. And what does that mean? It's just can be anywhere from an adventure to catastrophic. And it oftentimes spurs a desire to make drastic changes in their current lifestyle to capture one's youth. You hear stories about, people going out and buying a fancy car, or, doing something just because they're in this, oh my God, I'm changing, and what does that mean for me? And for some people, it can be exciting. It can be an adventure. It can be, insightful. It can be an opportunity to explore oneself and to reassess and reappraise one's values. And so it's fun. Always fraught with a little bit of, because change does not come easily for people. I don't care how much you love change. There's a little tension that's involved in it, but it's okay. Your head is wrapped around it, and it can be a little bit exciting. For others, can be a little confusing. It makes you feel a little empty, like there's no meaning in your life, maybe a little restlessness, like I don't know what's going to happen to me. I've always been this person. Well, now I'm this person. And what does that mean? How am I going to handle it? Am I up for the job? Am I valuable? Am I valued? And so it just sets off this whole line of questioning and self-reflection. And then there are others that it's just horrible. They get depressed, they feel anxious, they feel a sense of disillusionment. They don't know who they are. They don't like who they are. There's a lot of self-loathing and self-doubt. Before this presentation tonight, Jeffrey and I were talking about it. We were talking about celebrities and sports people who are put on a very high pedestal in our culture. And what happens when it's over? The higher someone up is on the pedestal, the longer the fall is. And you look at people who become drug addicts and hooked on depression on medication, and they're just like Shirley Temple, she was, a child star, and she just had a horrible time, and so many people. And so, there's a lot of compassion to be had and a lot of sadness around it too. And again, where do we as practitioners fit in this, and how can we help someone? And as a practitioner of cosmetic facial acupuncture, I see it all the time. And they probably won't tell you this in the beginning. They'll kind of mask it, but it's there. And our culture, and our Western youth-driven culture, we're not very nice to aging people. It's gotten better, and I think that COVID actually in some way has helped that, because a lot of people chose to stop coloring their hair, see this, and go gray. People have stopped, doing all their care things, and I think that, in many ways it's helped people to force them to go through some type of a reflective or self-evaluation, maybe when it hasn't been, forced on, well, it was forced on you, but, in some way I think that it's helped us. But in general, we are not, as a culture, very accepting or loving of the aging process, and for aging people as well. You look at many cultures take care of their aging when they are aging, and they look up to them as authorities or mentors, or we don't necessarily do that. So for our patients, although they're coming in for appearance enhancement, we know as facial acupuncturists that they're really not just looking for a superficial makeup, but for something deeper, something emotional and spiritually healing as well. And that's what we can do. So we look at this from two perspectives. We look at it from the physical perspective, we look at it from the emotional perspective, and then we put the package together. So we see that in terms of treatment, we're going to look at it in terms of the influence or the balance of yin and yang, our chi, blood and fluids, meridian, song, organs and their systems. And from a physical perspective, we're going to look at the organ systems of the heart, the pericardiums, and small intestines, and send out as a complexion. And what is your complexion like? Do you have fine lines, broken capillaries, and some skin conditions, primarily rosacea? The spleen and the stomach system, we're going to look at muscle integrity, how the muscles change, whether they attenuate, how they attenuate over time. For the lungs and the large intestine system, we're going to look at skin quality. We're going to look at the texture of the skin, the pore size, and other skin conditions like acne that might occur. From a perspective of the bladder and the kidney systems, well, we know that it's about aging. The kidneys and the bladder are about premature aging, fragility, bone resorption. It's really how we age over time. And then the liver and the gallbladder is the most, a little confusing, but in some way very impactful. We think of the liver system in terms of the ligaments and tendons and the way that muscles contract. Well, on the face, we don't have a lot of tendons. Really, then on the face, muscles attached to muscle, and muscle to skin rather than to bone. And on the face, when muscles contract, they actually move the skin. So for the liver system, we're looking at the smooth flow of muscle contraction, which leads to wrinkling and skin creasing. On another level, we're also looking at the emotional component of it. We're looking at the fire, the heart, and the joy. So many ways you look at how people socialize. And actually, COVID was a very poignant and interesting entry into speaking to our patients. So you may ask them, I mean, you're not going to ask them, well, how do you socialize? But you can say, well, how has it been for you during COVID? Do you miss your friends? Do you miss going out? What do you miss the most? And so that becomes a question about how to access, how to get into that concept of, is the heart a little bit off in the aging process? When we talk about the earth, the spleen system, we think of the spleen in terms of digestion, but it's also about digesting your thoughts, digesting your ideas, how you feel about yourself. Self-esteem are all tied into the spleen system. And so you can ask questions about, well, what, how was it for you during COVID? Did you, you just ask questions, that would be poignant. What do you think about it? How did you feel about it? Oh gosh, did you feel like you got more wrinkles? Well, what does that mean to you? Are you okay with that? And so that's kind of your entryway into the psycho-emotional component of what we do. Grief is the lungs, and really that's about grief of letting go, kind of resentment of letting go, regret, the things that you might have regret. So you ask questions like, what do you, or things that you would have done or could have done differently that you wish you had done. And so you will get information from relating to that system. The kidneys was an easy one. So much fear, so much anxiety in terms of death, relating to death and depression throughout COVID, but also in the aging process. So that's a pretty easy one that you can see that in their face. You can see fear in someone's face. You can see depression in someone's face, and you can feel it in their affect as well. And then frustration, anger, the liver system, that just flares. It's right out there. You can see it. So not only can you hear it in their voice, but you can also see it in their face, because the face holds all of the emotions of our body. If any of you have studied with Lillian Bridges, she's kind of the master of face reading in our field. She's wonderful. And she talks about emotions and how to see them in the face and how to diagnose them and how to, tips for how to heal them on an emotional level. And she also, this is her chart, she was kind enough to let me borrow it, but also she has a map of how wrinkles form on the face based on the organ system. So in this, the blue area is related to the kidneys, the green liver is liver, pericardium is the reddish one, the tip of the nose, and then it goes on. And so you can see how the face is divided into different areas and how activity, emotional activity related to each of those areas actually will form creases or wrinkles in that area. And as we resolve those emotions, as we let go of some of them, the ones that we're aware of, and deal with the ones that have been repressed, we can actually change that. Wrinkles start to soften, our face starts to lift, things start to look more vibrant and alive. And what's so interesting about this is, I don't know of those of you who have heard of Paul Ekman in the 1970s, he actually started the facial action coding system. It's used throughout for so many things. It's used in the police department to help people determine whether someone's lying or not. It's used by animated film industries to help create expressions. I know my father's wife is a well-known psychologist, and she had to be able to memorize all of the facial expressions and actually make them in her practice. And what he found is that there are 7 universal micro expressions. So micro expressions are different than learned expressions. Micro expressions, something happens and you're either not aware of the emotion and it lasts for less than 5 seconds. You're, a little like your forehead creases or an eyebrow lifts or a corner of your mouth lifts or your nose flares, but something happens and then it goes away. So if you are repressing an emotion, it might happen. Or if you're suppressing emotion, if you're deliberately trying to conceal an emotion, you might make it, bam, it goes away. And those 7 identify, and they're universal. There are learned emotions that are more cultural, but this is universal throughout, all of the different cultures throughout the world. They are anger, contempt, disgust, enjoyment, fear, sadness, and surprise. And so these emotions can, if they happen enough, can actually create creasing in different areas of the face. So for example, let's look at anger. Anger is this area in Chinese medicine. It's between the eyebrows. And on a physical level, what's happening is these frontalis muscles are lifting. The corrugator muscles right in here are contracting, and what begins to happen is you begin to get creasing between the eyebrows and across the forehead. Well, according to Paul Ekman, the same thing happens when someone's angry, like in the liver system. What happens? They begin to pull their eyebrows together, their eyes opening wide, their forehead lifts, and you start to see creasing over time between the eyebrows and across the forehead. So there's a very strong connection between what we see in Chinese medicine and what has been discovered in our Western medicine world. And in terms of treatment, from our perspective, we're treating both. We're treating both the physical, we're treating the wrinkles or whatever the facial concern is, and those are really just the symptom of an underlying pattern disharmony. So we need to treat that as well. So we treat the root underlying pattern of disharmony, whether it's liver qi stagnation, frustration, repressed anger, and we use body points. And then we're going to treat the branch or the wrinkles with face points. So we do our patterns of disharmony. We treat the body, the legs, the arms, the torso as our patterns of disharmony. So we'll treat that. Say, let's make this up and say it's the liver system. And then knowing also by looking at the physical complaints, we will then use face points to address those symptoms or those concerns, in this case, wrinkles. So I'm going to give you a case study as an example and kind of show you what I mean. This is a patient of mine. He was a 44-year-old male. He came in for acupuncture for enhancing facial appearance. And that was his primary complaint. It had been going on for a couple of years. His friends were kind of giving him a hard time. This creased, so forehead and glabella. This is the glabella area, forehead creasing. Had been getting worse. So he had headaches. He had a history of carpal tunnel syndrome. He had asymptomatic mitral valve prolapse, lumbar pain. Didn't care about any of that. He just wanted to get those wrinkles out of the way. So I did what I do, and I came up with my diagnosis. We talked about, different things like aging. He was in his 40s, so things were happening. And I had seen him for other things too. So we had the conversation about aging and what that meant and his discontent with it. And so I used points. Here's my point selection. And here's what I did. So here is, I treated his neck, cheek area, and in Chinese medicine, for facial acupuncture, we learned that you can't just treat one area because everything is connected. You have to treat the neck, you have to treat the lower face, mid face, and then the upper areas as well. And the angling of the needles was very important. The way that I work is I base my treatment plans on my needling techniques from the Ling Shu. And the Ling Shu is our classic text on Chinese needle therapy. And it says throughout this text, there are numerous discussions about needling guidelines specific to different layers of the skin. So we have the upper layer of skin, we have the flesh in between, which is our muscles, we have the channels that go through, and then we have bone on the face. And in the Ling Shu, it says this in chapter 1, the skin, the flesh, the muscles, the tendons, and the meridians occupy different places in the body, and different diseases respond to different methods of treatment. And then it goes on to say in chapter 7, if illness is superficial and needling is deep, it will penetrate and injure the good fluid. If illness is deep and needling is superficial, results will not be obtained. So it's there. And for me, the way that I have interpreted it and the way that I work is I angle the needles relative to the intention of my treatment. So the needle angling is relative to the surface of the skin. If I want to address the superficial layers, the dermis and the epidermis, I'm going to needle my angle very superficially to the skin. If I'm going to go more into the fat layer, I will angle it a little bit more slanted. And then moving deeper into the muscles, the meridians, and the bones, it's going to continue to move from a 45 to a 60 degree and then into the bone for a 90-degree angle. And for the very superficial, you can use it for a number of different things. You can use it for pain, inflammation, itching, skin conditions, and wrinkles is a great, by shallow needling, you can address wrinkles. By needling into the muscle layer, you can affect the way muscles change over time, and adhesions, which also is very much related to wrinkles. You can also treat through the meridians, the congestion in that muscle and channel, which again relates to the emotional and the physical component of it, and any type of muscle-related injuries. And then if you're going to go into the bone, you're going to use it for more like TMJ or TMD. But again, by inserting the needle in any of those directions, you are going into the meridian systems as well, and treating the emotional from the back end by clearing the meridians. And there's a lot of research to support needling from a Western perspective at each of those different levels. So collagen enhancement from the superficial level, needling for facial elasticity in the soft tissue, through the muscles and down into the bone. So there's a lot of research, both from a physical perspective, but also from a body, mind, spirit paradigm. So there, in this particular research piece, by Ang, Fay, and Hobbs. This was in the Medical Acupuncture Review, and they're talking about the mind, body, spirit paradigm, and they say the mind, body, and spirit are inextricably linked. There are many advantages to viewing psychiatric or emotional disorders through the lens of holism rather than using a more reductionist approach, which is what we do. Whether premised under classical concepts of yin and yang or qi, or on modern ideas of autonomic modulation, TCM-based therapies do provide relief for patients who suffer from anxiety, depression, PTSD, sleep disorders, and many other conditions that plague the human mind. And we don't need research to know that that's true. How many people treat your patients and they get off the table, and not only are their physical pains diminished, but they feel better too. They just feel like a different person. They feel like themselves, or they feel better than themselves, or they finding themselves, or something inside has shifted. And we know, if you look at even with the before and after picture of my patient in this case study, look at the difference in him. He looks angry, he looks mean on the left, and then look at the difference afterwards. He felt as good as he looked. And then in retrospect, he actually realized how angry he was before. Didn't even know it. It just kind of creeps up on you, doesn't it? And then at some point he just said, "Oh, thank you so much. I feel so much better." And it didn't matter how, well, it always mattered, but it didn't matter as much, or there wasn't as much importance placed on the wrinkles. They were better, but just from a deeper, more psycho-spiritual perspective. So in conclusion, in addition to improving the physical signs of aging, cosmetic facial acupuncture opens the door to self-love, inner contentment, and personal acceptance. And for me, this is why I love my job. I love treating with facial acupuncture. It just gives me so much pleasure to actually help people look and feel better on so many different levels. So what has been so exciting and super exciting for me is the Pacific College of Health Sciences and I are partnering. We are going to, for those of you who do not know this, I have in the past offered a 100-hour training program, an intensive training program for cosmetic facial acupuncture. And it's been with, I'll just pass this on. So the philosophy behind it is, we want to offer you as many different treatment approaches. There are so many talented people in our field, both teaching things like facial diagnostics, motor points, all different types of treatment styles. And so the purpose of this program was to bring together everybody, all of the leaders in the field, and bring them to you under one umbrella to be trained in facial acupuncture. And so the college has said, "Oh yes, this is a great idea, let's do it." So we put together the facial applications for cosmetic enhancement. It's the phase program. The advantage of it being through the Pacific College is you can get financial aid. It's the same great team of people under a well-known fine institution in this country, and offering college credit and over 140 hours of continuing education credit. So I hope that if this is something that you're interested in, here's the details on the bottom: admissions, pacificcollege.edu/face, and their phone number. So thank you. If you have any questions, I'm happy to answer them.
Well, thank you so much, Shellie, as always. And then it looks like there is a question in the chat right now. So is this in person or online?
That's a great question. It will be done. It will be performed virtually. It starts in January. It ends in July. It's 2 semesters, and it's virtual. Like the school offers is a lot of virtual classes with 5 days of hands-on clinical experience. And you have your choice. You can either do it in New York City or in San Diego. We'll be running them then twice. So, but most of it is virtual.
Perfect.
Virtual classroom. So it's like a classroom, but you don't have to. You can do it in the comfort of your own home.
All right. Well, we do have a couple questions here. First question is, do you have a template for an intake form that you would mind sharing with us? And then how long is your initial consultation?
Oh my gosh. Okay. So I'm happy to share my template with you. So Jeffrey, should I just forward it over to you?
Yep, forward it over to me. And then Elizabeth, if you'd like to send me an email, I'm going to put my email in the chat, and I will go ahead and send that over to you.
But I will do that. But I also want to say that the way that you present everything, your appearance, your environment, your website, your Instagram page and your paperwork is all a reflection of you. So I am happy to share it with you, but I would encourage you to just use it as a template and personalize it for your own style.
Perfect. All right. Well, I was hoping that I would put my email address in there, but it looks like a few people have added there. So I will email it to them.
Okay.
Perfect. And then so Shellie will send it to me, but like Shellie said, please personalize it for yourself. This is, just a template as a little bit of inspiration. All right, we do have another question. Actually, I have a couple questions about the course, so let's get those out of the way too. So would they sign up directly through Pacific College?
Yes, everything is going through the college. They're handling all of the admissions, the financial aid for those who want it. I'm always happy to answer questions, and you can reach me at info@hamptonsacupuncture.com. And so I will always answer questions, and I'm available to talk to you about it. They're going to handle all of the registration.
Perfect. All righty. And then how do you treat asymmetrical puffy eyes with acupuncture, or would you also include herbs?
I do include herbs. I have been trained in herbal medicine. I tend to be my protocols are patterns, and they're somewhat basic. If I want more depth, I refer them out to people. And I have a host of people that my team, my herbalist that I send people to, my dermatologist that I send people to, even a plastic surgeon, because I can't help anybody. And part of this too is managing expectations, which is another lecture. But that's extraordinarily important. So.
All right. And then let's see. Can you mention treatment of rosacea, more superficial or deep? And then what about rosacea of the eyes? Yeah.
So rosacea comes in stages. Rosacea of the eyes is probably more advanced. and dangerous. So if you see rosacea, and it's usually related to disharmony in the blood level, so it's past the Wei level, past the Qi level, past the Yin level, it's in the blood level. Have them go see their dermatologist first, manage it, and then you can treat it as well. But like any type of disorder like acne, rosacea, that type of thing, it starts at the surface and starts to move down, and in each level it gets progressively worse, like most diseases.
Perfect. All right, and then let's see, it looks like we have a couple more questions here. Let's see, do you have to be an acupuncturist to join the program, or can you be an RN, APRN, or PA?
Okay, good question. So this year, 2022, will be just for acupuncturists, and then the next year we're going to open it up to massage therapists, estheticians, and other fields. So we're looking at acupuncture this year and acupressure next year. So it's just, this program is just going to continue to grow. It's so exciting to offer it to people. And acupuncture students, I just saw that question, call the school about that, because I know that it's open to people at certain levels of education, and so that we just call the school.
Perfect. Let's see, I think we have at least one more question. Let's see, I think it was actually in the chat. Bear with me one second. Can you, oops, sorry. How do you treat actinic keratosis?
Yeah, so all of these skin disorders are another, it's another conversation. You know, I don't want to, not answer it, but it's a huge, huge topic. Also, Mazen Al-Kahafe, he's great with any type of skin disorders. I don't know if he's ever going to do anything with you, Jeffrey, but he's just he's a real master of dermatology.
Oh, wonderful. And then somebody did have a follow-up on the rosacea. Would you treat with Western medicine, or so you would treat with Western medicine with antibiotics, and we would then do a constitutional treatment or specific facial acupuncture?
So a lot of rosacea is a gut problem. We have the vagus nerve that runs from the brain through the gut, and there's a loop that kind of regulates gut biosis. So, any type of gut dysbiosis goes right to the skin and creates acne, rosacea, a number of skin disorders. So particularly with rosacea, sometimes rosacea is from a leaky gut syndrome, or it could be bacteria on the skin related to poor gut biome. So you can treat it both ways. You can treat it topically, you can treat it systemically, and you can also you can treat it with acupuncture.
All righty. So it looks like we have one more question, and they would like you to talk a little bit about broken capillaries around the nose.
That is one of the first signs of rosacea. And when we look at this from an acupuncture perspective, we are looking at two things. We're looking at the heart and the ability to deal with the vasculation of the capillaries, or their ability to hold it together, which is a spleen, which is the ability to hold blood in the vessels, and also gut issues. So really, if you have anyone that has any type of rosacea, make sure that their spleen, stomach, digestion is strong.
All righty. And then we have one more question that just got asked, so I'm going to ask it. If you could please share some ranges of treatment length, treatment plans, and then cost for facial acupuncture. Okay.
Acupuncture, so think of it as any type of treatment, whether it's back pain or fertility or whatever. You're going to look at it from a systemic point of view, what's going on. you are going to treat the underlying pattern disharmony, and then the symptoms are wrinkles, sagging skin, dry skin, dull skin, acne, rosacea, whatever it is. So you can treat it as a regular treatment, which would be 60 minutes. I tend to use microcurrent, LED light, ancillary services like facial cupping and facial gua sha. So my treatments can be an hour and a half long. And based on the value of your time, the level of your experience, how much physical time you actually spend with the patients, and what you need to make, you know, to pay your bills, or, you know, whatever you feel like you need to make, that's how you're going to charge. You also need to compare it to who's around you and what they charge as well. One of the great benefits of adding different things and specializing is you can add different things, which makes you a little bit better, or, you know, having gone through trainings makes you a little bit better and gives you a little bit more clout. So that's a big question. You know, how much you charge is based on who's around you, what the market will bear, and your level of expertise and what you bring to it. So I would say anywhere between, you know, $150 to $500 a treatment.
All right. Well,
that's crazy, right?
It's a pretty big range.
It's a big range. It's a big range, yes.
But I'm guessing it's different if you're treating in, you know, New York City or Miami versus, you know, rural Kentucky.
Yeah, I mean, yeah, it is a big difference.
All right. Well, that is all we have for questions for tonight. So I want to thank you so much for your time and this incredible information. So guys, in the chat, also in the email that you're going to get 5 minutes after, there's links to the FACE program where you can learn more. You can get information on the cost and the dates and speaking. You know, thank you again. Shellie's also speaking at the Pacific Symposium. That's going to be at the end of October, I believe.
Yes, it is at the end of October. And yeah. And also, you know, for those of you that are interested, we're, for better or worse, you know, there's a limited number of people that we're going to take, so you'll get quality attention. So.
All right. Well, just to let everybody know about our upcoming events, on Tuesday, August 17th, we will be hosting Matt Callison for Sport Medicine Acupuncture Protocols and Integrated TM and Anatomical View of Motor Points. And then on the 25th of August, we'll be hosting Diana Horowitz and Amelia Vargas for integrative microneedling for aging. And then on September 1st, we will be hosting Dr. Jason Howe for neuroacupuncture for treating post-COVID syndrome and challenging neurological conditions. So we have a lot coming up for you guys. Please visit Shellie's website, which is hamptonsacupuncture.com. And I will send out the intake form as soon as we get the intake form from Shellie.
Great. And thank you so much, Jeffrey. Really, always a pleasure to present with you. And thank you so much for having me tonight.
Well, thank you very much. Everybody have a wonderful night. We will see you next time. 1 second.